Hi, my name is Veronica Llamas. I'm the Quality Improvement Quality Assurance Epidemiologist. Today I'm going to be talking about IQIP and the School Immunization Survey. We're going to start with IQIP, and we're going to discuss what IQIP is. IQIP stands for Immunization Quality Improvement for Providers. This is a program that is CDC developed. It is a quality improvement process designed to increase immunization coverage for VFC enrolled providers. Evidence-based strategies were used to create 4 core strategies that are proven to increase vaccination coverage rates, and of these 4 strategies, 2 are selected for implementation when starting an IQIP cycle. Overall, IQIP is a 12-month process, which includes an initial site visit, a 2- and 6-month check-in, and a 12-month follow-up. This program connects the VFC program and providers through the regional coordinators to effectively collaborate and support one another to increase immunization rates. The IQIP participants are inclusive of an IQIP coordinator. The coordinator develops written awardee operational guides and trains the consultants according to CDC guidelines. They also ensure data integrity and track and monitor the process of the QI cycles in every region. Next is the regional coordinators or the consultants. They conduct the site visits and the follow-ups, generate reports of provider-level vaccination coverage, and identify opportunities for process improvement, and provides technical assistance as necessary. Finally, the provider and provider staff, they are a key part of the IQIP program. During the QI cycle, they're the ones who are going to implement the strategies into existing workflows and target work processes to make improvements so they can increase vaccination coverage overall. They're also the ones who are going to collaborate with the consultants to identify opportunities for process improvement and implement these strategies into their workflows so they can effectively increase vaccination coverage rates. And they're also the ones who are going to discuss the barriers and the issues that they're facing when it comes to ensuring that the population is vaccinated and vaccinated on time according to ACIP's recommended vaccination schedule. This is the IQIP process, an overview. So again, there's the site visit, which the QI consultant and the provider staff meet in person. They review assessment reports and set coverage goals, discuss and select 2 of the quality improvement strategies, and the consultant also provides technical assistance at this time, as well as helps the provider staff establish action items for the selected strategies, and the action items are what will be talked about in the 2- and 6-month check-ins. So then it takes us to the 2- and 6-month check-ins, which the consultant and the provider staff or provider are just doing a quick phone call. They review the selected strategies and action items, discuss how things are going, make any necessary changes, discuss further barriers, and identify any areas where technical assistance may be needed. And if necessary, they would establish new action items at this point. And if needed, if they wanted to switch up any strategies, that's the 2- and 6-month check-in is when that would happen. Finally is a 12-month follow-up. This visit is also done by phone. At this point, the consultant and the staff go over year-over-year coverage changes. They continue to discuss the action items and how implementation of the action items went for each strategy, identify further barriers, and get technical assistance or as needed, establish new action items, maybe action items to continue quality improvement even aside from IQIP, and continue improving vaccination coverage rates or maintaining vaccination coverage rates as needed. And then at this point, at the end of this visit, the consultant would send the provider a high-level summary of the overall 12-month cycle, any coverage level changes, and any ongoing action items that were selected and discussed. These are the 4 core strategies. They are facilitate return for vaccination, leverage the IIS functionality to improve immunization practice, give a strong vaccine recommendation, strengthen vaccine communications. Facilitate return for vaccination is a core strategy that focuses on the implementation of clinical and clerical processes that support keeping follow-up appointments and addressing barriers for patients returning to the clinic for vaccination. Action items that could be consistent with this strategy is implementing a reminder recall system, taking action to prevent missed opportunities, using effective scheduling protocols, maybe taking the time to ensure that a patient is scheduled prior to them leaving the clinic or prior to checkout when they are still in the patient room, maybe right before vaccination occurs, just to ensure that they're on the schedule for their next appointments and ways for the staff to make sure that they're calling them, giving them reminders of the appointments coming up so they can ensure that they're coming in for those visits. The next one is leverage IIS functionality to improve immunization practice. On-time vaccination depends on tracking patients' vaccination status and knowing which vaccines a patient is due for. The providers can use NIMSIS in our case to maintain patient vaccination information and determine patient vaccination status. Um, with NIMSIS, we could use reminder recall functionality reports, assess the practice performance and generate practice level coverage, assess immunization status. Another action item is to ensure that the clinic knows how to see what a patient is recommended for in regards to next vaccination. We could also generate patient line lists to ensure that patient information is up to date in the clinic. So they are having accurate coverage reports with good data quality. The next one is give strong vaccination recommendation. On-time vaccination and catch-up depend on parents choosing to vaccinate their children, and providers play a critical role in creating vaccine confidence. This strategy focuses on helping the provider adopt or improve upon making a strong vaccine recommendation. Implementing this strategy will support providers in addressing gaps in coverage that may exist due to low vaccine confidence. Action items for this strategy is using effective communication approaches, using assumptive language or sandwiching recommendations to kind of make everything flow very naturally. Listen to parents and seek to understand any concerns that they may hold. Reduce disparities and promote vaccine equity. And also just receive routine training on vaccines in general to keep up with any updates, changes, and know how to best answer any questions regarding vaccination that may come from parents. Finally, strengthen vaccine communications. The spread of vaccine myths and disinformation puts patients at risk for vaccine preventable diseases. Confidence and trust in vaccines are built through conversations between parents, doctors, nurses, pharmacists, and community members. Patients and parents can feel more confident about vaccinating when everyone in the practice shares the same message. Everyone is essential in supporting vaccination from front desk to the exam room to checkout. Action items within this strategy are promoting the provider's vaccination policy by sharing it practice-wide, promoting patient and parent education by including vaccine-related promotional material, posters, flyers, brochures, anything really to create a vaccine-positive environment, and also by promoting vaccine in an equitable way, really concentrating on the fact that vaccines are important for everybody. So having vaccination material in languages spoken most in the community is very important as well. So when you go through the IQIP to complete it successfully, of course, like I stated earlier, out of the 4 strategies, 2 are selected for implementation and they're put into existing workflows with the main goal just to increase vaccination coverage. The provider and the consultant discuss action items for those strategies, and those are the action items that are focused through on the throughout the IQIP cycle. Of course, they're interchangeable. You could edit them as needed and receive technical assistance as needed. The IQIP consultant and providers will have the check-in at 2 and 6 months to assess how the implementation is going and make those changes as needed. And the 12-month visit will cover a year-over-year coverage of data and discuss strategies and resources for continuation of strategy implementation to continue increasing vaccination coverage or maintaining it. Next, we'll talk about the school immunization survey. School entry required immunizations are a key factor in protecting children in the community. The annual school survey is created to assess coverage rates throughout the state to ensure that vaccination is happening on time and is providing the best immunity to keep children healthy. The school immunization survey is sent to all New Mexico schools yearly, typically in September and closed in December, meaning that about 3 months to report immunization status of the students. All data is analyzed and reported to the CDC for MMWR reporting and updated on the NewMexicoHealth.org website. Also on that website, there's a school immunization dashboard, which is updated as the school immunization surveys come in and is reported to CDC. And on this dashboard, you can see easy percentage data regarding the immunization coverage levels for the schools and specific areas. When you go on the NewMexicoHealth.org website, this is what the school entry requirements look like. School entry requirements are posted on that website and updated annually. The entry requirements are based on recommendations from the CDC and ACIP, and any changes that occur within CDC or ACIP or in New Mexico requirements, they're highlighted in yellow for easy reading, and the dosage is highlighted as well as any explanation that's needed as to why those changes were made. Of course, with entry requirements, we do provide vaccine exemptions. We offer 3 types of vaccine exemptions, which are inclusive of a medical exemption, in which a certificate from a licensed physician, a physician's assistant, or a certified nurse practitioner stating what the physical condition of the child is that immunization would be an endanger to their life or health of that child and why they can't be vaccinated. The first religious exemption is the one in which an affidavit or written affirmation is needed from an officer of the recognized religion stating why a child shouldn't be vaccinated and that it's against their spiritual beliefs. And the final one is a religious exemption in which a affidavit or written affirmation from the child's parent or legal guardian is needed, expressing the religious beliefs and that are held either individually or jointly that don't permit the administration of a vaccine or any other immunization agent. Here are some common questions we get asked about vaccine exemptions. The first one is, who can get a vaccine exemption from NMDOH? Any student that is age 0 to 18 years old or enrolled in a grade ranging from daycare to 12th can get a vaccine exemption. Homeschool children do need a vaccine. Any student who's attending a public, private, homeschool, daycare facility, or any child care facility does need an exemption if they are not going to be vaccinated. Which vaccines can a patient be exempt from? Just the ones that are school required. So again, on the nm.org website is that school entry requirement grid. Any that are required for school entry can be exempt from, but that does not include the flu vaccine, HPV, COVID-19, because those aren't school required. New Mexico does not allow philosophical reasons, just the 2 religious and the 1 medical exemptions are the only ones that are offered. To process the vaccine exemption, it typically takes 1 to 3 days to do, but by law, we do have 60 days to process that form. You can find the current vaccine exemption form on the NMDOH website, Or you could also find the form in the Reynolds building in Santa Fe where the drop-off box is as well. And that goes into how is the form submitted. It can be mailed to the address on front of the form and then dropped off in the box by the security in the Harold Reynolds building in Santa Fe. How to complete the form. The form should be filled out and submitted by the parent or guardian on behalf of the child. It should be filled in completely. It needs to be legible and it needs to be notarized. It is important to point out that it needs to be notarized the same date that it is signed by the parent. Any religious affidavits or medical affidavits should be attached to the form. Process. So when they're mailed in, it is important to note that the mail is checked and processed daily except for when the state offices are closed, so state holidays. Forms are reviewed and then they are approved or disapproved and copies are made. Approved forms are entered into NIMSIS and a copy is mailed to the parent or guardian and all originals are filed. Disapproved forms are documented in a tracking spreadsheet and filed. And then parents are informed as to why the form was disapproved. And exemption forms are retained by the immunization program for 3 years per law. So going back a little bit, we're going to talk about the school immunization dashboard. The school dashboard is a quick way to look up a school or an area and see vaccination coverage via a map or again at school level. It is possible to see the percentage of the school for kindergarteners or 7th grade, whichever are enrolled, or both if both are enrolled in that school. And then you could also see percentage coverage per vaccine antigen. The dashboard is updated annually as new school data is received and calculated from that annual self-reported immunization survey. This is what the school dashboard looks like. There is a map view of it, or you could go by school. It does show kindergarten up-to-date status as well as 7th grade up-to-date status, again, depending on which is enrolled in that school or both. If both is enrolled, that's displayed here on the screen is how you will see that information. And in the bar charts at the bottom there, that's what percentage looks like per antigen. And then in this area where the map is, you could type whatever schools you're specifically looking for right there in the search. And if they self-reported information, it will be on the dashboard. The school immunization survey also collects data regarding any potential barriers that are being faced among the students in the schools to get vaccination. And this information is utilized by the immunization program and partners to create initiatives and plans to address these barriers and increase vaccination coverage. Some of the program efforts that we've been able to have and use to alleviate some of those barriers are our campaigns for vaccination, the HPV initiative, our Got Shots event, Boo to the Flu event, use of our mobile vaccine unit, lunch and learns, and then office hours to provide information, and immunization quality improvement or IQIP for providers so we could improve some of those issues that we're seeing and use this information to help implement new processes and ways to get people vaccinated or educated on vaccines. That's all I have to share. Thank you so much for taking the time to listen. And if you have any questions, please feel free to reach out.